Hello everyone, welcome back. Today I'll be covering physical examination of shoulder, starter of introduction, general principle of shoulder examination. Special tests include bicipital groove palpation, speed test, Yergason test, lift-off test or Gerber test, empty can test. Now let's get started. As an introduction, physical examination tests of the shoulder pads aim to reproduce specific symptoms and signs as an aid for clinicians in diagnosing the painful shoulder. However, more than 180 different single pads have been described in the literature, making the choice of which test to use challenging. In addition, confusion arises because different names are used for the same test. Example, supraspinatus test is also known as empty can test, also known as Jobs test. Several of the single pads have been used for several different shoulder diagnoses. Example, Yergason test originally published as a test of biceps pathology is also used as test of glenoid-labral pathology. Inspection, palpation, passive and active range of movement, and strength testing of the neck and shoulder, which are compared bilaterally, is done. General principles of shoulder physical examination. On inspection, any shoulder swelling, scars, muscle atrophy, and asymmetric posture. Palpate any common tendon points such as acromioclavicular joint, coracoid process, and greater and lesser tubercles of the humeral head. Range of movement. Active and passive shoulder range of movement should be examined in all 6 directions: flexion, extension, abduction, adduction, internal rotation, and external rotation. Power. Muscle power in flexion, extension, abduction, and adduction. Lastly, spatial shoulder test. Special tests are key components of the physical examination. For bicipital groove palpation, the examiner places his or her finger on the proximal lateral aspect of the arm and rolls over the humeral head. The bicipital groove can be palpated between the greater and lesser tubercle of the humerus. Tenderness originating from the bicipital groove may be attributed to the pathologies of the long head of bicep brachii tendon. This picture illustrates the bicipital groove palpation. Try to palpate the groove between the greater and lesser tubercles of the humerus, positive when there is a tenderness during palpation. Regarding speed test, the patient flexes his or her arm in 90 degrees, extends the elbow, and supinates the forearm. The examiner gives a downward force on the participant forearm or the patient forearm. A positive test is considered when in case of pain during resistive shoulder flexion, which may be associated with shoulders of the long head of bicep tendon or a slap lesion. This figure illustrates the speed test, whereby the arm is flexed in 90 degree, elbow in extension, forearm supination, and the examiner exerts a downward force and the patient resists the downward force. For Yergason test, the patient flexes his or her elbow in 90 degrees with the forearm pronated. The examiner exerts a resistive force onto the patient's forearm while the patient attempts to supinate. A positive test is considered in case of pain over the bicipital groove during resistive forearm supination, which might be suggestive of bicep tendon pathology or slap lesion. This figure illustrates the Yergason test, whereby the elbow is flexed in 90 degree, the forearm is supinated, patient will resist the pronation, and positive when there is a pain over the bicipital groove. For lift-off test, also known as Gerber test, used for subscapularis tendon disorder, the patient stands with her or his arm internally rotated and his or her hand placed on the low back or buttock. The palm should face against the body. While the patient attempts to lift the hand off the body, the examiner exerts a resistive force to hinder this movement. Is positive if patient feel pain when moving hand away from the trunk. This figure illustrates the Gerber lift-off test. The arm is internally rotated and the hand at the buttock region. The patient tries to lift the hand off the body, while the examiner uses a resistive force. For empty can test, also known as Jobs or supraspinatus test, the patient abducts his or her arm to 90 degrees in the scapular plane with his or her elbow extended. Maximal internal rotation of the patient's arm is performed with his or her thumb pointing downwards to the ground. The patient resists the downward force given by the examiner. A positive test shows a pain during resistive arm abduction, pathology over the supraspinatus tendon or muscle. This figure illustrates the empty can test or Jobs test. Abduction in 90 degrees, elbow extended with maximum internal rotation of the arm, with examiner put a downward force. Yay! We have reached to the end of this video. I hope it helps. See you in the next one. Take care and bye.